Well, after a brief but alarming uptick in positive COVID-19 tests in the Thunder Bay district, the number of active cases is once again on the decline. As of yesterday, there were about 56 active cases. Meanwhile, vaccination clinics in the city and at local pharmacies continue to be very busy. The health unit is also starting to roll out vaccination clinics in rural areas. All of this taking place against a backdrop of concern around the rise of the Delta variant, which appears to be more contagious and more resistant to vaccines. Dr. Janet DeMille is the medical officer for the Thunder Bay District Health Unit, and she joins us this morning for our weekly update on the COVID-19 situation. Dr. DeMille, good morning.
Good morning, Amy.
Have we seen that Delta variant specifically identified in this area yet?
We have had two individuals with the Delta variant in our area in the last several months. There's no active cases of the Delta variant at this time that we're aware of, but we have had two, and both of these individuals were directly related somehow to international travel, so being in people who've either come back from an area where the Delta variant is more prominent or somebody closely associated with somebody who had returned. But they were isolating.
Okay. The variants we are seeing here right now, which is most common in this area at this point?
So there's always a bit of a delay before we get all the results back, but the biggest proportion is that what's now called, I think, the Alpha variant, which is that B117, or used to be called the UK variant. That is the one that has been most prominent in Ontario, and about 80 to 85 of our cases, at least that we've had that are VOCs, are that one.
In terms of that Delta variant, so only two cases so far. How does that variant, though, rank in your list of concerns at this point?
Number one, and well in advance of the other ones. It is concerning, and I think part of it is just the uncertainty about the Delta variant, and it's one of the newer ones. It's impacted other countries. I mean, what we see and what we're learning from a lot is from the United Kingdom, where they had a lot of that Alpha variant, and it's essentially been replaced with the Delta variant, and certainly their experience and what's happened. And then we know that it is in Ontario, especially in the GTA area. And it is, as you indicated, seemingly more infectious than any of the other variants that we know about. And when you see, it's unclear about whether it causes greater need for hospitalization. But what we do know is that the vaccine works. It works against all variants, and it works against this one. However, with the Delta variant, it works much better with people that have had two doses of the vaccine.
And I do want to talk about the vaccine effort, but first, I mentioned an uptick in cases recently, and there was that cluster of cases in the Greenstone area and in surrounding First Nations. What is the situation in that area at this point?
So we still see cases that are appearing, and but the numbers seems to be dropping, which is of course what we're working. We're working with many partners in those communities to support, bringing this to an end. It is very difficult. These are variants of concern, not the Delta one, but they're spreading, and it is hard to, when you have a cluster and people with COVID. COVID spreads, and it can spread easily, and whether it's in that cluster or anywhere, and so it's just a need to making sure that people are diagnosed, that people are isolated, that they're supported in that isolation, and that other people who may be at risk are also protecting themselves. And so we are seeing the numbers drop, and hopefully that will continue. But there's still work to be done, and we're involved with our partners and those communities in helping that happen.
Does any of that work involve an effort to accelerate vaccinations in that area?
Absolutely, and that is a parallel conversation that's happening. The challenge is you can't necessarily, or you shouldn't necessarily vaccinate somebody who's actually isolating or who has COVID. You can wait till they're finished their isolation, and so whenever there's a cluster or an outbreak, it's hard to just go in there with the vaccine. The vaccine takes sort of 2 weeks to work, so it can't stop a cluster, but it can certainly prevent it from happening again. But yes, and people who may have been in whatever situation, somehow reluctant or maybe hadn't taken advantage of a vaccination in the past, when they're confronted with a sort of a COVID situation that might be impacting them, whether directly or indirectly, it's often, motivates people. So we do want to take advantage of that and this opportunity to help various communities increase their immunization coverage.
So speaking of the vaccination effort more broadly now, so we have people over 12 that can get vaccinated at this point. Some second doses are happening as well. Yeah. How busy are the clinics right now?
So there's a lot of people that are eligible for vaccine. I mean, for lots of people, first doses, anybody 12 and up, and we're starting to see the accelerated second dose strategy. So there's a lot of people, and we are, for the most part, filling up our clinics, and in fact, trying to open up more appointment spots. We are still, our limiting factor is actually our supply. So we are getting a lot of supply, and across our numbers show there was 10,000 doses of vaccine delivered this past week, 7-day period, and that includes through us, all our partners and pharmacies. So that's really great about what we can do. But we are really trying to open up appointment slots in the future based on what we know we're going to get for supply. And I would just have, asking people to be patient and that we're going to be opening up more, and anybody who wants that vaccine should be able to get it.
How many people have you been able to vaccinate per day recently?
So at the CLE Coliseum that we run here in Thunder Bay, that the health unit runs, we're up to 1,200 a day. The hospital also runs a clinic, and they're capable of putting through a fair number as well. And then we have various partners, the district communities, the family health teams in the various municipalities in the district, Indigenous health partners that continue to sort of run their clinics, Superior North EMS, Norwest Community Health Center, other family health teams are really out there almost every day doing immunization. So it's a real collective effort,